And it's really the differences that exist in arthroplasty design, its impact on biomechanics, on patient outcomes, and how we can leverage that information to try and better suit individual patient profiles. So specifically, I'm going to be talking about anatomic glenoid designs. I don't have any relevant financial disclosures, but I will say I use a lot of different implants for a lot of different reasons. I don't think there is one singular right answer, and I'm pretty sure no one really has that singular right answer. So I think it might be better to talk in some generalities. So what I'm going to do is talk a little bit about the goals of anatomic glenoid reconstruction, outline some of the current options that exist on the market, discuss each of their pros and cons, and then try and link it together at the end with my algorithm of what I try to do in my own practice so you have something practical to take away when you go back to work on Monday. So what are our goals? Really, we have 4 goals, right? We're trying to facilitate anatomic kinematics of the head, so a smooth platform for the ball to roll on. We're trying to restore the joint line without overstuffing. We're trying to establish longevity, so making sure what we put in actually lasts a reasonable amount of time. And then for the inevitable revision, we're trying to make sure that it's a streamlined revision with minimal bone loss. And while we often tackle these things in isolation, we realize that they're inextricably linked. When we try to optimize one, we invariably affect the other, sometimes not with good results. And when we look at the evolution of glenoids over time, this cyclical theme starts to make sense, right? Because what was old becomes new again, and we end up iterating on the same 3 themes. We try to optimize fixation, materials, and shape so that what we know works in the short term hopefully starts working in the long term. So what are our options? Well, there's really 3 broad categories, right? There's all poly onlays, there's infusion of some type of metal, whether that's a convertible, a metal back, or a hybrid,